on event of World Sight Day, and our country celebrates it as a World Sight Week. We are very happy to take care of eyes because eyes are so precious and the sight is so gifted. And every human should be very happy to have wonderful vision, wonderful sight. Without vision, it's tough to live in this world. So, as there are multiple causes which can uh, create problem for a person's sight or a vision, it's very important to take care of them. It's only when somebody loses the vision they really understand the actual importance of vision. Until they lose, they take it very easy. So it's very important to take care of this precious God's gift given to us, the wonderful pair of eyes. There are so many preventable blindness which can be taken care with the invent of wonderful technology available in this world today. So one of the preventable blindness is cataract. Cataract is nothing but an opacification in the lens. The lens is a crystalline lens which is in the eye. It's God created and it's in the center part of the eye. And the entire eye is around 23 to 24 millimeters from the front of the eye to the back of the eye. And every layer of the eye or every structure in an eye is so important to have a wonderful vision. So this crystalline lens becomes opacified or rather loses its transparency. The lens has to be transparent for light rays to travel inside, go till the retina and to the optic nerve and then through the visual pathway to the brain, and it comes back and you see. That's how this beautiful visual pathway takes place inside, and that's what we see this wonderful nature so beautifully also. So the vision is so important, and actually when this visual pathway, if there is any hindrance or any problem or any obstruction in this pathway from the front part of the eye till the brain, the patient does not see properly. And one among the media which gets opacified, as I was saying, is the lens, and the opacification of the lens leads to cataract. Cataract is one of the leading causes of blindness in a country like India, where patients do not come to the doctor at the right time. They in fact feel that they can go to a doctor or go to an ophthalmologist till their eye gets almost blind. So now with the technology and with the advent of wonderful surgeries like phacoemulsification, you can really take care of cataract in a very easy way. Actually, in a patient with cataract, the vision is so blurred. The patient actually sees a very misty vision or a foggy vision actually. The vision which has to be beautiful, appreciating the colors and all other thing, it becomes very dull. So the opacification of lens is what is called as cataract. So cataract can come to anyone. Anybody can get cataract, from even a child to even an adult. Cataracts very common are the adult cataracts or senile cataracts, which are very, very common. So people who are aged have these cataracts. And there are other cataracts which come as a complicated cataract, which is a complication of another disease. Like a patient may have diabetes, a patient may have any other systemic problem which leads to a cataract. So that is a complicated cataract. The senile cataracts are the one which you get it for as per the age. Age is very important. So these cataracts can be treated very well. There are other group of cataracts which are otherwise called as developmental cataracts, where the child may have a developmental cataract and does not affect the vision at all, and we don't have to bother much about it. But a cataract which is due to a complication, a cataract due to a senile, hindering the day-to-day activities of the patient, hindering the profession of a patient, we need to handle it. So with today's technology, you can treat cataract in a very fantastic way. And the advent of phacoemulsification, this wonderful surgery, which is an a walk-in, walk-out surgery, and you don't have to stay in the hospital, and life becomes so easy, and the patient can get back to normal activities or get back to the profession within few days. And the vision is so beautiful the next day after a surgery. The reason being, we perform a micro incision cataract surgery, which through making a small incision, very micro sized incision on the cornea, go inside, emulsify the cataract with the ultrasonic waves and wonderful machines and technology available today. We suck and emulsify and remove the cataract so easily, and we also implant the intraocular lenses, which can be introduced to the same incision, the same micro incision. The reason being, in olden days, they used to make a larger cut, a 12 millimeter opening, remove the cataract, and may or may not place an intraocular lens and stitch all around, and the visual outcome is not so good. But whereas in phacoemulsification, after you do a wonderful surgery and implant the intraocular lenses inside where the natural lenses were there in the same place, that's called as a capsular bag, where you introduce them, the patient immediately sees so beautifully. It's a foldable lenses which can be introduced to the same micro incision hole, and the lens goes inside, opens like a flower in the bag, and the patient sees so beautifully. And that's what is very important when you see a cataract patient. You should advise cataract surgery, and patients can definitely get it treated, because as I was telling you at the beginning, it's an avoidable blindness, or otherwise called as an preventable blindness. In India, it's very common because the rural population is too huge in India. Of course, in an urban developed places, also in a city, in any metropolitan city, the patient comes to a doctor so late. Of course, in rural, the patient may come a little late because poor awareness, the fear of the surgery, all this. But now, with the advent of technology, with the advent of wonderful skill from the ophthalmic surgeons, and as well the beautiful intraocular lenses, the patient sees the world so beautifully the immediate next day post-operatively. On event of World Sight Day, which is celebrated in the month of October, in India celebrated as a week, we ophthalmologists and as well certain non-governmental organizations join together and try to spread and create a lot of awareness among the public regarding the avoidable blindness and regarding the importance of vision and sight. It's only when we lose a vision, or somebody who is not able to see properly, he or she realizes the importance of the wonderful vision what we have, what God has gifted to us. Because eyes are so precious, and the vision is gifted to us. We need to take care of them and prevent most of the diseases and take care of this wonderful, precious God's gift to us. And on event of World Sight Day, what I thought to tell you was regarding the avoidable blindnesses, or otherwise called as the preventable blindness. There are multiple blindnesses which can be cured, which can be treated, which most of the public may not be aware of, or may not be having an idea that it can be treated, cured, and you can have a wonderful vision. So among them, there are many like cataract, glaucoma, and certain other problems which can be treated. Someone even with a refractive error in a country like India, in a rural population which is maximum, do not understand that even a refractive error can be treated. So they are so unaware, and they just relax and stay quiet and forget that something has to be done for the vision. So glaucoma, being one of the important causes of sight-threatening vision loss, is one of the important disease which I thought we should discuss today. The reason being, glaucoma is a silent killer, and it's a silent thief which takes away vision at night. So that's why we do not realize, or rather the patient does not realize until he becomes blind, that he had a condition called glaucoma, which he or she did not get the eyes tested to an ophthalmologist and missed such a important disease happening inside the eye. The reason is, glaucoma is such a condition where even with the last blinding stage, the patient will be able to see properly. The reason is, the patient would see a 6 by 6 in a Snellen's chart, When I say Snellen's chart and 6 by 6, what I mean is you go to an eye doctor, he makes you sit and read on the board in front of you. That is called as a Snellen's chart, and the last line what you read on the board is 6 by 6. That's the best visual acuity. And with glaucoma being in a last stage, a patient may be able to read the last line. The only problem in glaucoma the patient does not realize is the visual field gets lost. When I say visual field, what I mean is the side vision. If I'm seeing a person directly, or if a person is seeing me eye to eye, we also understand that we have a side vision. We will be able to see what is there in our right side, what is there in the left side. That's how the vision, that's called as the side vision or the field of vision. In glaucoma, what happens is this field of vision starts coming into a tunnel vision sometimes. The field of vision reduces. Sometimes we have had patients coming and telling us, who's a driver who's been driving at night or some time of the day, telling that I don't see a car coming in right side of me most of the time. Or even some patients come and tell us that I feel somebody standing over there, but I feel so, but I can't see them. That's the problem when the side vision gets restricted. It happens in glaucoma. That's why it is a silent thief, as I said. So to diagnose glaucoma, the patient, anybody who's about 35 to 40 years of age, needs to go and get an eye check thoroughly to an ophthalmologist. You cannot go to any other vision center or any other place who just get your eyes checked for your spectacle or any other reason. You need to meet an ophthalmologist, which is very important. The reason being, an ophthalmologist will be able to check your vision, check the intraocular pressure, otherwise the eye pressure, like the blood pressure what we have in the system in the body. Eye also has a pressure which is called as an intraocular pressure, which needs to be normal. The normal intraocular pressure is anywhere between 10 millimeters of mercury till 20 millimeters of mercury. Anything about 21, 22 is supposed to be an high intraocular pressure. Why am I talking about the intraocular pressure now? Because it has direct connection with glaucoma. Glaucoma is something which affects the optic nerve. We have an optic nerve from the brain. We have two optic nerves coming through the visual pathway right into the eyes from behind. And this optic nerve can get damaged because of the high intraocular pressure. Each eyeball has a certain pressure which I was talking. If the intraocular pressure increases, then naturally the pressure building inside causes damage to the optic nerve. Once the optic nerve gets damaged, then your vision is lost. As I was telling you before, it's the side vision which is getting lost. The side vision which keeps on getting lost. Even at final stages of glaucoma, a patient will be having a tunnel vision. He'll be able to see even any distance in something like a tubular vision. But if the side vision is gone, the nerve is damaged, it cannot be regenerated back. That's why glaucoma is important. It has to be diagnosed very early and treated very early. As I was telling you, it is an avoidable or a preventable blindness. When something can be prevented, when something can be treated, why not? Give the benefit to the patient. A patient needs to come to a doctor, check the intraocular pressure, and if the pressure is normal, well and good. If the pressure is not normal, it has to be treated with medications. We have these anti-glaucoma drops which are used to be instilled in the eyes regularly every day so that your pressure is coming down. Like the blood pressure in the body, if anybody has hypertension, blood pressure, he takes a tablet, his blood pressure is maintained. Likewise in the eye, the intraocular pressure also needs to be maintained, as I was telling you, 10 to 20 millimeters of mercury. These simple eye drops can take care of your control of your eye pressure and prevent the damage to the optic nerve, invariably save the vision. Because vision is such a wonderful thing, it's God's gift to mankind. Once loses it, such a problem like glaucoma, the nerves cannot be regenerated, and a vision is your loss of sight or the blindness is a permanent loss. So when you can treat it, please get yourself treated. And glaucoma is some condition where, as an ophthalmologist, we diagnose it at whether it's an open angle glaucoma or a closed angle glaucoma. What I'm talking about is, eye is a ball. Eye has a structure inside called the iris. There is a small passage, is an angle from back part of the eye. The fluid called aqueous humor travels and comes to the front part. The angle is the passage through which the fluid comes out. If this angle gets blocked and the fluid does not come out, then it is a closed angle glaucoma. But for few people the angle is open, but but due to various other conditions, the pressure builds up inside and creates an increase in the intraocular pressure, invariably leading to the optic nerve damage and invariably leading to blindness. So it has to be diagnosed whether it is an open angle glaucoma or a closed angle glaucoma. This closed angle can be narrow angle or otherwise called as occludable angles, where you need a simple outpatient laser procedure which would treat and create a bypass over there so that the fluid comes out. Simple outpatient procedure when there is a closed angle glaucoma. When there is an open angle glaucoma, you need to treat it with eye drops, very simple. So by doing both these treatment, if your pressure is controlled, well and good, you prevent a blindness. At the same time, for certain people, you require surgery. When the pressure, intraocular pressure is very high and the optic nerve damage is already set in, which is an advanced glaucoma, then you need to do a simple surgery called as trabeculectomy. By doing this procedure, you make the fluid passage, create a fluid passage once again through a surgery, gives a permanent remedy most of the time. So glaucoma is such a condition where it is important to be diagnosed early, treated early so that you can prevent blindness and give wonderful sight. So dear friends, it's very important to understand that eye is such an important, precious structure in human body, and if you miss it or if you don't take care of it, you're going to create problem to your vision, to your life, to your profession, anything. So beware of the problems. Please take care of your eyes. It's so important. Eyes precious, so please take care of them.